course, she may go off the deep end again. We'll see what happens. I think I understand.
Because like, I know a lot of students who are in a psychology program right now, they want to go into counseling.
Right.
Like probably like 80% want to go into counseling. And it's really research-based, which is really nice to get the like idea of how articles are and like how
Sure.
to read them and all that
Exactly.
stuff. But like, we only have one counseling class here, and it's like, we want to go into counseling.
I've got good news for you. We have a second counseling class next year, and potentially a third, if I can get everybody to agree that we should teach human sexuality. If we teach human sexuality, that'll be 3. And we need it. We do need it.
And the people that can't handle it, like, why are they becoming a psychologist?
Exactly.
I can't handle it.
They're not going to be able to handle it. The reality is that everybody there's a sexual aspect to everything. And pretending that it doesn't exist doesn't make sense. And it may be traditional for you not to talk about it, but at the same time, that very frequently is what the problem is based on, is based on sexuality. So we need to deal with this, and we need to talk about it. Oh, geez, I already turned this thing on. Okay. I guess we're starting since I've already turned the camera on. Okay, so we talked about some of the reasons that people are taking opioids. We talked about the fact that it's a cough suppressant. It was used as a cough suppressant, and of course, people were dying of tuberculosis. The other problem was the 2 great killers in the world in the 19th and 20th century, beginning of the 20th century, 19th, 17th, 18th century, was tuberculosis. Tuberculosis was killing a lot of people. The other problem was dysentery. There's a lot of diseases that cause diarrhea. These individuals were dying they're squirting themselves to death, as horrible as that sounds. And who was dying? Well, usually it was the kids. It was usually the young ones. And the old people were dying of pneumonia, they were dying of tuberculosis, they were dying of dysentery. Very, very common. And it would sweep through whole sections. And usually it was the poor sections of cities. So the opiates were really very important, and they were invented or developed in order to take care of these really serious problems that were killing most of the people in the world. Opioids affect every part of your body, but especially your heart, your lungs, your brain, your eyes, your voice box, your muscles, your cough center, your nausea center, your reproductive system, your excretory system, and your immune system. My God, that's everything. This is what keeps you alive. Your heart, your lungs, your brain, your eyes, your reproductive system, your excretory system, and your immune system. So one of the things that happens when you take opioids is that it messes everything up. It screws everything up. Yes, sir?
Yeah, last night I was looking through YouTube, and there's a Motley Crue drummer. His spine and all the nervous system, I guess, it fused together. He had it since he was a teenager, so it made him go like this.
Yeah.
And his spinositis or something.
Yeah.
So he confessed he was
Spondylosis?
Yeah, he was medicated with opioids, and it got to where it just became he was just like waiting to die.
Yeah. Well, it makes you feel like you're dying.
Yeah.
Opioids make you feel like you're dying, and people like that. That's what they're after. That's the euphoria that they're after.
Yeah, he was a chunky guy in the beginning,
Yeah.
Now he's just frantically just touching it. It's like a
He
spray
doesn't.
or something.
He doesn't eat. He doesn't have to eat. He feels sick all the time. Physical side effects of opioids, but especially heroin, include insensitivity to pain, of course, and this is what we're after. It lowers your blood pressure, which is kind of nice if you've got high blood pressure. It lowers your pulse, which is kind of nice if you've got high blood pressure. It lowers your respiration rate, which isn't nice really for anybody, and it makes you confused. So these are the effects that you have. It slows everything down. It makes you feel like you're dying sometimes. And a lot of people like that. They want that because their lives are so intense. So why in the world would all of these, all of your favorite bands, why would all these guys become addicted to heroin. Why would they do that? I mean, these are guys who go out on the stage and they play their music. Of course, they play the same music over and over and over and over and over again. Gets a little tedious. But why in the world would they want to feel that oblivion? It's a feeling of oblivion. Why would they want to feel that? What is it about heroin that so many people in music have become heroin addicts? Why? Why would that happen? What is it about rock and roll music, or even the blues, or even, well, the saxophone player, the Bird, he died of a heroin overdose. Ray Charles was a heroin addict. Why in the world are all these people doing this kind of stuff? Why do they want to feel that oblivion? These famous people.
To like suppress their feelings or how they feel, or like if they had a traumatic event when they're younger, it's a way for them to forget.
Forget? Well, then, geez, there'd be a lot of people trying to forget. What is it about musicians? Have they all been raped as children? Sexually molested? Or what's going on with music? Why the drummer? Why Keith Moon? Why that crazy guitar player for the Who? Why are all these people heroin addicts? What's going on?
Cool.
It is cool. There you go. So let's not even think about the rest of it. A lot of people consider themselves fakers. I'm no better a guitar player, so one of the Beatles is going, I'm no better a drummer than anybody else. And I feel like I'm lying to everybody. I go out there and people try to tear my clothes off. I have to hide my face. I grow my hair long and try to hide my face. And it's mainly because I consider myself a liar, a fraud. And so they try to get rid of that with the oblivion of opioids. And this is very common in music. What's the difference between the guitar player for Redbone and the guitar player for the Beatles or for any Motley Crue or whatever? What's the difference? And the answer is nothing. You just happen to be the friend of somebody, and now you're part of this group. And okay, so it's that feeling that you're a fraud makes them need to find oblivion, and that's one of the reasons why they all, or why so many of them turn to heroin. At stronger doses, opiates, opioids, but especially heroin, might cause droopy eyelids, nodding head, slurred, slowed, raspy speech. I want you to think of somebody coming into the emergency room, and you see all of these symptoms, and you've got to figure out what's going on with these people. A slurred, slow speech, of course, that could be just about it. That could be drunk. It doesn't have to be an opioid overdose. Slowed coordination and walking gait, that's alcohol as well. Pinpoint pupils, this is it. That's it. That's how we diagnose people coming into the emergency room. Is we look at their eyeballs and we try to find whether they have pinpoint pupils or not. Otherwise, they're drunk. If they don't have pinpoint pupils, they're drunk. We don't have to worry about it.
How does that look?
What? Pinpoint pupils? You can't find their pupils. You look in their eyes, and the light hits their eyes, and their pupils just go completely away. You can't find them at all. And they're already that way, actually, but they do seem to get a little bit smaller. They have dried, itchy skin, but a lot of drugs will cause that problem, especially crystal meth, methamphetamine users, speed users, amphetamine users. Suppression of the cough center, hindering the clearance of phlegm. This is not that uncommon with other drugs. Vomiting due to the activity of the nausea center. Alcoholics will have vomiting fits as well. Severe constipation, of course, we can't usually figure out whether their bowels are backed up or not. Delayed menstruation, that's another thing that we have a difficult time discovering. Reduced testosterone production in males, and of course we're not drawing T levels on all these guys. Dulled sexual desire to the point of indifference, and of course that's one of the reasons why I was telling you before, the crack whore is a possibility. This individual is going to be able to finance her drug usage, or her and her boyfriend, or her and her whatever. She's going to be able to do that with by selling herself. But it doesn't work for people that are heroin addicts. It doesn't work because their sexual desire tanks. It goes completely away. It's the last thing on their mind. They become almost totally asexual. And one of the reasons that this happens is because the testosterone level goes away. Whether they're male or female, the testosterone level goes away. And your testosterone, your hypothalamus, is your sex drive. And if your testosterone is reduced, if you're a female, of course, now you have no sex drive whatsoever, and if you're a male, it's heavily reduced. So the probability of these people turning tricks in order to pay for their heroin addiction is fairly remote. Why is all this important? Well, it's important because we're trying to help these guys. We're trying to figure out what's going on. One of the ways that you can stop this is by stopping the way that they make money. And of course, you don't have to worry about these people becoming prostitutes of one ilk or another. What you do have to worry about is these people becoming criminals, thieves, breaking into places. The heroin addicts have no other way of making money other than thievery. Tolerance for opiates, opioids occurs when the body tries to neutralize the toxin. It does this by speeding up your metabolism, especially in the liver. It desensitizes the nerve cells that the substance affects. It increases drug excretion by increasing your urine, your feces, and your sweat output. If you've ever been around somebody that's a heroin addict, they stink. And the reason they stink is because they sweat. And the sweat is the sweat of fear. Why in the world would they smell like this? Because they're afraid they'll go through withdrawals. And it scares them shitless because they're constipated. But it stinks. It really smells bad because it's a smell of fear. And you can smell this on heroin addicts. And sometimes, and of course you're not supposed to diagnose people by the way that they smell, but sometimes if somebody comes into the emergency room with all of those symptoms that we saw before, and they smell like they're afraid of something, then you can probably diagnose them with heroin overdose. And of course, at that point, you give them naltrexone or Narcan or whatever. Alteration of the brain. I'm sorry.
Does that reverse the chemical reaction?
It blocks the opiate functioning in the brain stem. It blocks it, and so they start breathing. If they can't breathe before, now they start breathing. Their heart starts beating a lot faster. It blocks it, and usually it'll bring them back. Of course, you don't want to give somebody naltrexone if they don't have an opium overdose. Well, you can if they have remember that dopamine loop that makes people want to drink more and want to shoot up with this or that or the other. It blocks that as well. And since it does that, it will bring people back from any kind of a drug overdose, including alcohol. Alteration of brain chemistry to compensate for the effects of the drug. And of course, the brain is trying to balance itself. It's trying to be normal. It wants to be as normal as it possibly can. So the brain chemistry, of course, is trying to compensate for that. And you can imagine some of the crazy stuff that people do. Your brain is always trying to be normal. It's trying to be balanced. It's trying to be average. It wants to come back from that. And of course, if you drink, it tries to balance itself. If you shoot up with crystal meth, of course, it's the same situation, or smoke it. Opiates, opioids, tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect, unfortunately, because the tolerance is so high. So whereas yesterday you used just a little bit of heroin, next week you may be using 10 times as much as you used yesterday. Chronic use of opiates, opioids can cause permanent changes in the brain. Animal studies show that heavy usage of opioids will reduce the dopamine-producing cells in the ventral tegmental area by 1/4. Now this is okay? No, it's not. Now you can't find pleasure. Now you're going to have a hard time being happy, which is kind of unfortunate if you think about it. But that's not the end product. The end product is Parkinson's disease. So you've heroined yourself into Parkinson's disease. We know a lot of people that had a good time when they were younger, and now they're, of course, suffering from Parkinson's disease. It probably had to do with cocaine, could have had to do with heroin. They may have been a heroin addict. The two that I talk about all the time, Michael J. Fox and Linda Ronstadt, both of those were heavy cocaine users. Those two are cocaine users, not heroin users. These individuals don't usually make it that far. They usually die from one thing or the other. There's a lot of things to die from. We're going to talk about how they're killing themselves, and this is just a way of truncating your life, dying in your 50s or 60s, unfortunately. How long are we supposed to live? I think I've asked you guys this question. How long do you think you're going to live? How old are you going to be when you die? 25, 26, 90? 90 is a good age.
Triple digits.
Triple digits going from
Yeah.
100. 90 is a good age.
I don't know. My grandma died at 60, and but she was like ate fast food, unhealthy type of lifestyle. So.
And you're smarter than
I guess, yeah.
that. Okay.
So maybe about 80, late 80s, 90s.
80s, 90s, okay. Monique, how long do you think you're going to live? 90? 90 is a good age. 1,000?
95.
I like the 1,000.
I would say 80, 90.
80 or 90?
90.
90, okay. We're all going to live into our 90s, but if we do something stupid like take opioids, we're going to die in our 60s or 70s. We're going to die from something else, and everybody's going to go, "Oh, I'm so sorry he died. He had dementia, and he had Parkinson's disease for the last 5 years of his life. It must have been the Parkinson. Yeah, it must have been all that other stuff." No, hell no. It was the heroin that did it. It was the crystal meth that did it. It was the marijuana that did it. It was the alcohol that did it. If that's okay. So the opioid is reducing your dopamine-producing cells, which is not good, of course. You may develop Parkinson's disease later on in life. You can't feel pleasure anymore. You can't feel normal. In order to feel normal, you have to use heroin. That's the only way you can feel normal. At this point, the body relies on the drug to feel normal. You can't do it. Withdrawal from opioids may take place in 3 stages. Acute withdrawal, the body tries to return to normal too quickly, and that's the acute withdrawal, and that's what people are so afraid of. It hurts. It bothers you. It's not a whole lot of fun. Post-acute withdrawal, okay, so you've been using heroin just to be cool and just to feel normal. So how long does it take you to get over this shit that you put in your system? Well, the answer is 3 to 18 months. You're going to suffer from this for 3 to 18 months. Now, that's not the withdrawal symptoms. You're going to be stupid as... You're not going to be real smart. Your brain's not going to be functioning normal. Your brain's going to be trying to return to normal. And it's going to have a really, really hard time doing that. You're not going to sleep very well. You're going to have these strange mood swings that people think you're bipolar or that you're clinically depressed. And they may even send you to the doctor. And the doctor may look at you and they may go, we need to, I need to institutionalize you for a couple of weeks just to make sure you get over this depression. Protracted withdrawal, more severe emotional and severe symptoms that may start after the first month and last into the 30th week. And of course, we have extensive problems. Your blood pressure has been decreased, your body temperature is going, you're going to have a problem with your body temperature. Your respiration, of course, has been screwed up because of the heroin. Feeling of general uneasiness, whereas before you were using it so you could feel normal. Now, of course, you don't feel normal anymore. Nothing feels normal. So you've got this feeling of impending doom. This reaction might be triggered by environmental cues that incite memories of their addictive life. These cues can persist for decades after cessation of use. You've got drummers and guitar players and frontmen from different groups who have been clean for decades. All of a sudden, they go back, they fall off the wagon, and they start using heroin again because they have never felt normal since they stopped using heroin. Their idea is that they don't remember what normal felt like pre-heroin. That memory has disappeared. So the only normal they can feel is a heroin normal. And so they fall off the wagon. And then they kill themselves because their body isn't used to it. They shoot up with heroin. They shoot up maybe with the same amount they were using as they were finishing their addiction. And they just overdosed. And now they're dead. Whoops. I don't feel sorry for them. I'm sorry. I should. But I've held too many people's heads. I've cleaned up too much vomit from the emergency room to even... It pisses me off. It pisses me off. Because I'm the one that gets vomit all over their shoes. And I'm the one that's got to take my shoes home and wash my shoes, and I got it splashed all up my pants legs. That's irritating. Just because they're using heroin. Of course, that's my job, right? That's what I'm paid for, to get vomit all over my clothes. No, I'm a lab tech. I'm not supposed to be doing that. That's nurses to get that stuff all over. Short-acting opioids, 2 to 3 hours, result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. This is heroin, so you start going through withdrawals fairly quickly, within the same day as you were using. And this is one of the reasons why they're always chasing the horse, what they call chasing the horse. And of course, the horse is heroin, or it's the white horse because heroin is the best heroin is white. Mexican heroin, of course, is brown. It's about half as strong as the other heroin. So you're always chasing the horse. You need to shoot up a couple times a day. This stuff is really toxic, and as we're going to find out, it really messes your veins up. Heroin, morphine, Dilaudid, these are all the short-acting opiates. Withdrawal peaks at about 48 hours and lasts for 5 to 7 days. One of the things we're going to find out about heroin withdrawal, despite the fact that all these wimpy musicians who go through heroin withdrawals complain about it, and that's why they have to keep shooting up. The reality is people rarely die from heroin withdrawals. It's like having the flu. It's a psychological withdrawal that is the hard part. Remember, it can last for a year and a half. And that's why they won't do it. And that's why they go back to it. Not because they may die from heroin withdrawals. No, but hardly anybody dies from heroin withdrawals. But it's because it's a psychological thing. And this is the only normal that they know. And they may never know normal again, unfortunately, as sad as all this is. I know, I should feel sorry. All of Francis's friends, all of your guitar buddies and drummers and frontmen. Quiet Riot, yeah, their lead singer.
Kevin Cooper.
Yeah. Didn't he die of he was a heroin addict. He died. Yeah, and I think it was from an overdose, if I'm not mistaken. Long-acting opioids will delay the withdrawal symptoms from 1.5 to 3 days. This is methadone and LAAM. We don't really have LAAM. We're using it in the United States. It's used over in Europe for heroin withdrawals. It actually is a better method of using than methadone, the LAAM. Peak withdrawal hits at about 4 to 6th day, and recovery may take as long as 2 weeks from the methadone or the LAAM. Of course, in the United States, we have methadone treatment facilities, but we don't have LAAM treatment. There's actually one in the United States. Opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and the long-term opioids. Codeine, oxycodone, and propoxyphene or Darvon. Darvon? One of the curious withdrawal symptoms of opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by opioids. Now this is really weird because a lot of times you take drugs because it increases your norepinephrine level. It makes you feel like you can conquer the world. So people do these drugs in order to feel that way. But opioids it actually reduces the amount of norepinephrine in your system. And this is one of the reasons why opioids make you feel like you're dead. That is the feeling. It makes you feel like you can't do anything, which is weird because a lot of these drummers are not drummers. I keep blaming the drummer. The drummers seem to be the ones that kill themselves more frequently than anybody else. A lot of these individuals are doing this because they feel like they're frauds. And I don't know, it seems like it would tie into that whole fraud thing, but I don't know. Anyway, it lowers your norepinephrine level. All in all, people rarely die from opioid withdrawals as they may do with alcohol or sedative hypnotic withdrawals. The type of withdrawals that kill more people is alcohol withdrawals. It's really, really tough. So that should be a real fear. You're never going to die from opioids. It's like dying from the flu. I had a really good flu, man, and it killed me. Doesn't happen. The problem with opioid withdrawal is the fear of the withdrawal, since this is the area of the brain that is mostly affected by the drug. It's the paranoia that it causes. That's the real problem, is the fact that you have this fear that you'll be going through withdrawals, and it actually accelerates that area, or it exacerbates the problem in that area of your brain. Neonatal effects of opioids, and as I told you, my great-great-nephew was born as a heroin addict. As stupid as that sounds, she was a relative of mine. I feel so helpless. Why didn't I do something about it? I can't. It's my brother's family. I can't do anything. There's something wrong with it. And they certainly won't listen to me. They're a lot smarter than I am. I'm dumber than dirt as far as they're concerned. My brother's really smart, but his wife is arrogant. Oh, she's so arrogant. Like I'm not arrogant.
Do you guys how like a lot of psychologists feel like they can't help their family because they won't?
Yeah, because they know them before they became psychologists, and they know what ditwads they were before they were psychologists. So they never listened to them. My daughter is a exercise physiologist. She's a weightlifting coach, and my son, and are both weightlifters. We won't listen to my daughter for anything. She can't convince us of anything because we've been lifting for a really long time, and we knew her before she was a weightlifting coach. That's a problem. But you're right. Nobody listens to a psychologist. Nobody in their family does anyway. Until something happens, and then of course they ask you, "What do you think we should do?"
Or they'll call you drunk, like, what's wrong?
I hate that.
Oh my gosh.
Hate that.
Call me in the morning.
Exactly. Call me when your brain is not anesthetized with alcohol, please. Pregnant opioid users are at greater risk for miscarriage, placental separation, premature labor, breech birth, stillbirth, and eclampsia. She had to have, remember, it causes constipation, which is a really serious problem for a pregnant lady. But it also slows everything down. I mean, it slows everything down inside the placenta. And for this reason, the baby has a difficult time doing that somersault that they have to do in order to be born. So this baby was born breech. She had to have she was skinny because, well, she's a heroin addict and she didn't eat very well. And she smoked. My God, she did everything. She's just a horrible, horrible person. Somebody should have bitch slapped her a long, long time ago. Anyway.
Better edit that out.
Yeah, maybe that would have taken care of everything. Anyway, she had to have a cesarean section, and it was an emergency cesarean section because the baby's heart stopped beating. No damage, no brain damage. They got her really fast because they drew blood on her and found out that she had been using heroin. Yeah, I know. If the fetus survives these dangers, it will be just as addicted at birth as the mother is. Actually, it will be more addicted than the mother is. Though due to the size and dilution factors, the withdrawal symptoms are more severe. Low birth weight, high-pitched cry, irritability, tremors, exaggerated reflexes, diarrhea, which is dehydration. Geez, that's what the baby needs right after it's born, diarrhea. Rapid breathing, sweating, vomiting, sneezing, yawning, hiccuping. The baby cries continually, and it will not sleep. It may not sleep for weeks. It may not sleep for 5 to 8 weeks. It's in pain. It's in a lot of pain. So what do you do with this kid? Can you shoot him up with? No, you can't. No, you just gotta let him go and hope they survive. And they cry like a cat. I had a cat fight outside my house last night. These two cats were screaming at each other. And of course I have to give this lecture today, and I was thinking that's exactly what a baby that's strung out on heroin sounds like. They sound like a cat caught in a garage door.
You seen a baby cry? Or you seen a baby born?
Oh yeah, I used to work in the neonatal intensive care unit at Omaha, at the Children's Hospital in Omaha. Oh God, it was horrible. And you couldn't stand it. I mean, this is a cry for help. And you know that. I mean, you can feel that. Instinctually, you know that that's why the baby is crying. And despite the callousness that I try to show, the reality is that you can't be callous to that cry. It's just it's a cry of help, and you have to respond to it. And you can't stand more than 10 or 15 minutes around this baby, and that's what we had to do. We had to rotate the nurses through the neonatal intensive care unit, NICU, NICU, just in order for them to not get. And some of them started crying. I mean, it was horrible. You couldn't use a nurse that was sensitive because she wouldn't last more than 4 or 5 minutes in with that baby, and it cried all the time. All the time. And this was right at the beginning. This was cocaine. The cocaine addicted babies are the same, and we had a lot of cocaine addicted babies. This is back in the 80s, so yeah, it was bad. It was so bad. And they would rotate. I mean, I'm a lab tech. I'm not a nurse, but they'd rotate us through just because they didn't have enough nursing personnel to take care of things. It was horrible. The worst experience you can possibly imagine. Because this baby's telling you that she's in, or he, whichever the case may be, that they're in pain and that they need help right now. And that's what you want to do, of course. If a baby started crying outside the door, we would all react to that. The baby, somebody dropped the baby and started screaming, we would all react to that because it's instinctual. We wouldn't have a choice. Anyway, so you have to respond to this. After about 3 weeks of that, I would like to say you get used to it, and you do to some extent. You become a little bit more callous to it. But it can last for 5 to 8 weeks, and that's what happened with my great nephew, who was born addicted to heroin.
Is he okay now?
The last I heard, this is a really arrogant family. They don't want to communicate with anybody because they're better than everybody else. You know, their daughter's got schizophrenia. The granddaughter is a heroin addict, and she's married to a pusher. You know, they're better than everybody else. I communicate with my brother, but I don't communicate with any of the rest of the family. In the rest of his family. In the early 20th century, 4,000 to 5,000 people died from opioid overdoses every year. In last year, 130 people died from opioid overdoses every day. Every day, 130 people died from opioid overdoses. That's 47,450 people died. At the beginning of the 21st century, it was only 4,000 to 5,000 people died of this stuff. Now it's 47,450. So who created this problem? 2/3 of all the opioid overdoses now are fentanyl related. Prince, Tom Petty had 3 kinds of fentanyl in his system.
Was it Prince too?
I'm sorry? Prince, yeah, he died of fentanyl overdose. They found him the next day. Rigor mortis had already set in. But that was his second overdose of the week. He'd also overdosed in Moline, Illinois. He was on his way to Minneapolis, that's where he lived. And they had to make an emergency landing at the airport in Moline, Illinois, which is the Quad Cities. That's where I live in the summertime. Okay. They got all excited because Prince landed his airplane at the airport. It's purple. He's got. Anyway, not anymore. He's dead. Anyway, 47,450 people died last year from opioid overdoses. So 2/3 of them had to do with fentanyl. The other 1/3 had to do with OxyContin and hydrocodone. 14 million drug-related emergency room visits occurred in 2017 related to opioid overdoses. 14 million. Is that all? Just 14 million? Now you understand why this doesn't bother me so much. I've seen it over and over again. In one study, only 57% of the opioids were accidental. Remember, they can't feel normal unless they're on their heroin or their OxyContin or hydrocodone. They can't feel normal. They get tired, and sometimes they they'll purposefully overdose. What's the difference between a purposeful overdose and an accidental overdose? How the hell can we tell? I mean, we have to look at the eyes in order to tell what their problem is. What opioid overdoses look like: blood pressure drops, the heart isn't beating rapidly enough to circulate blood. If the blood's not circulating, then your lungs fill up with fluid. This is congestive heart failure. If your heart's not beating strongly enough, then it can't clear the fluids from your lungs, and your lungs fill up with water or serum. You die. You choke to death. That's congestive heart failure. The lips turn blue, of course, because your circulation isn't good enough, so you become cyanotic, what we refer to as cyanotic. The pupils become pinpoint, of course. As we said before, this is about the only way you can tell that somebody has really had an opioid overdose. Respiration begins to be raspy and rattled because your lungs are filling up with fluid. So it sounds like you've got the pneumonia or a really bad cough. And when you cough, you're coughing up clear fluid. and it's fairly liquid. It's not mucoid. You look like somebody just pulled you out of the water and you were drowning, and you're coughing up the water. That's exactly what it looks like. But it's salty because it's fluid from your body. They go into convulsions as much from the lack of oxygen as from the toxins, and of course, it looks like a seizure. Could it be epilepsy? It could be. So, everything looks the same. Death by overdose is one way to die from opioids. Another is to contract a disease from sharing needles. According to research, 50 to 90% of IV heroin users carry the hepatitis C virus. If you watch the right television shows, they keep talking about we have a new cure for hepatitis C. There's a reason why this is really important. It's really important because we've got a ton of people that contracted hepatitis C from using heroin, from using crystal meth, from using all of these strange drugs. So if you were cool back in the 1990s and the 2000s, then you may have hepatitis C. And despite the fact that you're not that person anymore, you still have hepatitis C. And there was nothing we could do about it. There was no cure for it. But now there is. We've got a cure for hepatitis C. So all of those cool guys, and I've never been cool, I've already told you that. I'm the least cool person in the world, and all my ex-wives will tell you that. Anyway, hepatitis C. I look at individuals who have only shot up for a year, shows a rate of 71.4%. My God. That's it. And they've got hepatitis C. And now, of course, there's a cure. So all those people are happy. All the cool people are happy. 20 to 40% of those infected will develop liver disease. 4 to 16% will develop liver cancer. And this is usually what kills people. It isn't that the hepatitis C, this will stay in your system forever, and you'll die with it. But most people will contract other problems, like liver disease, cirrhosis of the liver, or liver cancer. Now the problem is if somebody develops liver cancer, then one of the ways that we can cure that is by transplanting their liver. But if you've got hepatitis C, we won't transplant you. We can't transplant you. Your life expectancy is too short. So there's nothing we can do. Or there's nothing that we will do. We don't want to waste a liver. There's not that many livers out there. Okay. People die waiting for a liver transplant. 50% of all IV drug use, would you transplant them? Somebody with HIV or somebody with hepatitis C, would you transplant them? Yeah. What if it's your cousin? Your favorite cousin? Would you transplant them? What if they smoke? Would you transplant them then? This is a question that has been coming up lately. Kidneys, especially kidneys. Would you transplant somebody that was a smoker that needed a kidney? See, that has been one of the criteria, and they keep taking them to court, saying just because I'm a smoker doesn't mean that I shouldn't have a transplant. And they're saying, well, your life expectancy is cut by 8 to 10 years. Why in the world would we transplant you? They transplanted one of the most famous baseball players of all time, Mickey Mantle. Mickey Mantle was an alcoholic, and he needed a liver because he was dying of cirrhosis of the liver. And they transplanted him, and he died 14 months later. Everybody was pissed. What a waste. So he was a great baseball player back in the 60s and 70s, 50s and 60s actually. Anyway. A question that we all come up. And I had to deal with this on a daily basis when I was living in Omaha, because our job was, I didn't have anything to do with the decision. They would come to our hospital and complain about what we did. We were the hospital where we held the body. We held them. And then we transplanted them next door to another hospital next door. Anyway, we were the holding cells. So people would come and they'd start yelling at the nurses. It's kind of fun. Okay, so most of these drug abusers, HIV is another problem that we have. 50% of all IV drug users are HIV positive. There is no cure for HIV. 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are males. So we have a lot more males suffering from HIV in the United States than females. Females usually contracted it from having sex with males that were HIV positive. The males usually got it from either gay sex or from IV drug use. 7 to 10% of HIV/AIDS cases in the United States were transmitted through sexual contact with heterosexual or homosexual IV drug users. 7 to 10%. 70% of children with HIV had mothers who were IV drug users or the sexual partners of individuals who were IV drug users. So once again, we have mothers that don't care about their children, strangely enough. And of course, they're in love, and they're in love with somebody that is an IV. IV drug abusers will do just about anything to get their fix. As much fun as that is, except prostitute themselves because they have no sexual desire whatsoever. Sadly, and this is something that I've come in contact with on a relatively frequent basis. One of my jobs as a lab tech was drawing blood, and I was really, really good at it. But if somebody is an IV drug user, they sclerose their cells, their veins, which means their veins turn hard, and you can't get into them. So you try to stick it, and it bounces off. Literally, it bounces off. It's like trying to stick a needle in a rock. It's that bad. So it scleroses your cells, and this is usually from injecting, and of course they're not very good at it anyway, and so they're bruising the area, creating scar tissue, but they're also sclerosing the cell. It just turns hard. And what they'll do is they'll walk up the vein. So usually it's the antecubital area, so if somebody's a drug addict, you can see the track marks where they have gone above the last place that they injected. And they have to go above it because otherwise they can't get into the vein. It's too hard where they've injected the heroin. So you'll see track marks all up and down their arms. Sometimes they will use all the veins in there that they can get to on their wrists, in the backs of their hands, in between their fingers. Then they'll have to go to someplace else. They'll go to their wrists. They'll go to between their toes. There's a nice vein between your big toe and your second toe. They'll go into their neck using a mirror, which is not the easiest thing in the world, if you can imagine. And even if they're a male, sometimes there's a big vein on top of their penis. It's the dorsal vein on their penis, and they'll go to that. Now the problem is, of course, now they're not interested in sex anyway. It's the last thing they're interested in. If they use this vein, they can destroy their ability to have an erection. Sadly enough, well, not sad. I don't care. It's none of my business who they have sex with, or whether they have sex at all. Heroin users may inject themselves 6 times a day, and sanitation is rarely a top priority. They just want to get hit. They just need another fix. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices. I've got a picture. It is an ugly picture. You can look away if you want. Because the individual is immunocompromised by the drugs being used, the severity of the infections are sometimes catastrophic. They'll contract Staph aureus or Beta Strep Group A, which are very virulent bacteria. Sometimes it gets underneath the skin, and it eats the skin away, or it eats the tissue underneath the skin. And I got a picture, and like I said, You can look away if you want, but this is what necrotitis fasciitis looks like. I have no idea why he was injecting himself in the area where he was injecting himself, but he's a redhead, so, and he's also Scottish. There are several conditions that are more common among IV drug users and non-users. Necrotizing fasciitis is the condition where a virulent bacteria gets under the skin and it eats the tissue away. This can eat the tissue away right down to your rib cage, and it can kill you. This type of bacteria. Endocarditis, bacterial infection of the heart valves. Of course, that will kill you as well. Cotton fever is a short-term bacterial infection, but it's very severe, and they tend to have a very high fever that you can't bring down. So a lot of people die from all three of these problems, and as you can see, they were lucky with this guy. He's still got it behind him. You can't see, but he's still got it on his back. It's just the front that we get to see. Thank God. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug usage tends to start at different ages. The first alcohol averages about 16.8 years. The mean age for first tobacco usage is about 17.3 years. Marijuana is almost the same. The mean age for first heroin usage is 22.2. We refer to these drugs as gateway drugs, tobacco especially, tobacco and alcohol. Then you go on to a better high. Usually that high is marijuana. And if you still need a new high, sometimes you'll go to crystal meth, heroin. They're gateway drugs. And we've been looking at this for decades, and we've been talking about it being gateway drugs for forever, and it's true. They are gateway drugs. From first usage to daily habit averages about 1 year of sporadic usage to addiction. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4 found that after 33 years, more than half of them were dead. 50 to 100 times greater the general population. Half of them were dead. And this is one of the reasons why so many musicians die young. And of course we rue the fact that they're dead, their music is gone. We don't have Keith Moon is no longer with us. It's so sad that he was a heroin addict. And didn't Keith Moon, did he die of a heroin overdose? The lead drummer for he died young. He died in his 30s of a heroin overdose. And if there's a lot of heroin usage, we're going to see a lot of death, unfortunately. And they followed these guys for 33 years, and half of them were dead. That's what, 291. 291 of them were dead. What did they die from? They died from overdose, accidental poisoning. Usually it was a substance that they were using to cut their heroin with. They died, people murdered them. They died from suicide. They died by accident. They died of liver disease. Lots of things to die from, as much fun as that is. 44% still used heroin, despite the fact they've been using it for 33 years. 67% used tobacco to increase the dopamine level in their brains. 22% were daily alcohol users. 35.5% used marijuana to take the pain away. 19.4% used cocaine. 10.3% used crack, and 11.6% used amphetamines. The group reported high rates of mental health and health problems. Most of these people were on welfare. They didn't have jobs. They couldn't hold down a job. I mean, you have to shoot up 2 or 3 times a day, so you certainly couldn't hold down a job. The group that now averaged 57.4 years reported frequent interactions with the criminal justice system, of course, because they were doing something illegal. They were also trying to cure drugs. Okay, now we're going to talk about the different types of opioids. Morphine is metabolized by the liver. It's 3 to 6 times the morphine. 3 to 6 times the morphine must be ingested to get the same effect as an individual gets from an injection. So taking an oral dosage doesn't really work very well. You need to inject it. Morphine will be detectable in the urine for several days after ingestion, and of course, that was one of my jobs when I was in the military, was checking people's urine. As much fun as that is. Or watching people pee. That's no more fun, I can assure you. 1 out of every 6 Americans has a chronic pain problem due to either arthritis, back injury, cancer, burns, severe tissue damage, severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain issues. And a lot of individuals will not, or a lot of clinics won't deal with this kind of stuff. They will have a sign outside their building saying, "We do not treat chronic pain." My wife was running a rural health clinic in Montana, and it was in between 2 reservations. It was in between Rocky Boy and Fort Belknap, and they had a sign outside their facility saying, "We do not issue narcotics. We don't have any narcotics." And of course, there were 2 reasons for that. One, they didn't want people to break in, and the other was that they didn't deal with chronic pain. It's just too difficult. In one research of chronic pain sufferers, 72% had suffered for more than 3 years, and 34% suffered for more than 10 years. From this research, about half were afraid to use opioids, muscle relaxants, or sedative hypnotics because of fear of tissue dependence and addiction, fear that the painkiller might mask more serious diseases, fear that they might be thought of as a drug seeker trying to supply a habit. Risk factors in morphine addiction includes kidney and liver problems. All the opiates have to be cleared from your system. They're toxins. And they're very destructive to the liver, they're very destructive to the kidneys, even if it's prescribed. Drug abuse history, medical drug usage, mental health history is another risk factor. Hereditary factors that make the patient more susceptible to all of these problems. So if you have a weak liver or you have weak kidneys, this is not a drug for you. Now that usually doesn't keep people from using it. And they kill themselves relatively quickly. Codeine is used for cough suppression. As a cough suppressant, it is a Schedule II drug, and when it's mixed with another drug for pain control, it's a Schedule III drug. Okay. We do use it for pain control. I had my tonsils taken out in 1970, and they gave me codeine to take care of the pain. It didn't work. I was mad because it hurt. I was 20 years old and I had just had my tonsils taken out. I almost bled to death. It was fun. I had a good time. And the codeine didn't work. But I found something that did work. And that was Aspergum. As weird as that is, aspirin worked and the codeine didn't. Codeine was the most widely prescribed and abused opiate in the United States. Once upon a time, it's no longer the #1 opiate that is prescribed. Vicodin is the #1 opiate prescribed today. Hydrocodone. Hydrocodone was what Rush Limbaugh was using. You know, you remember Rush. He was getting his maid to claim about and get his drugs for it. He was fun. He's not addicted anymore. He's clean. Don't worry about Rush. These 2 individuals died of cough syrup overdose. Really? You can overdose on cough syrup? Yeah. It was a cool thing to do back in the 1990s. Was drink a bottle of cough syrup and go out and dance. course, you dance like an idiot, but that's not important. You can see how cool the both of them are. They both have their hands like this. I have no idea what that means. Anyway, they're both really cool guys. Pimp C and DJ Screw. Whatever that means. Okay. Usually what they mix it with and what makes them overdose isn't really the cough syrup as much as it's the alcohol they mix with the cough syrup. And of course this was something that people did at clubs in Hollywood, and of course my son was there. They did have an overdose at one point. My son was a bartender there. So this guy's overdosing, and you know, all these people are dancing, and he just collapses right in the middle of the dance floor. So my son jumps over the bar, and he runs, and he can't get to the guy because everybody wants to see what's going on. So everybody's just standing around, and he's trying to force his way through, and all these people are just, you know, like they're like blocking him, and he can't get through. It was funny, and so he started grabbing people and throwing them. And about the time he grabbed a female and threw her, then people got all upset about the fact that he was doing that, and everybody started looking at him rather than the guy that was dying on the floor. And that's how he got through. That's how he got. But they were able to save the guy's life. They called 911, and they came within minutes and shot the guy up with naltrexone. Back then, naltrexone only cost $1.20 for a dosage. Anyway, saved the guy's life. Also, hydrocodone is also known as Vicodin, Hycodan, Tucin, or Norco. It's a Schedule III drug. 120 million prescriptions were written for Vicodin in 2006. They tried to reduce the number of prescriptions. I looked up the number of prescriptions written in 2017, 120 million. So theoretically, they reduced it, but they've written the same number of prescriptions. How does that work? Fewer people, more pills. That's why 120 million prescriptions. Abuse of this drug usually is precipitated after the drug has been prescribed legally. Heavy abuse has been known to cause hearing loss. 60 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants. I checked this out. It's like 14,000 people died last year from hydrocodone. Like 14,000. 600, it's not usually the Vicodin all by itself. And for that reason, a lot of times they don't talk about the Vicodin that caused the problem. They talk about the mixing of. How much fun is this? Am I having a good time yet? Not quite yet. Methadone, Darvon, and Demerol were developed by the Germans. During World War II, the Germans couldn't get to any opium poppies. The reason they couldn't get to them was because the British controlled all the morphine. They controlled all the opium in India and in Afghanistan. So the Germans had to come up with synthetic opium. And they came up with methadone, Darvon, and Demerol. So they're completely synthetic. They had no opium at all. So they had to use something else. Methadone is less powerful than morphine and lasts longer in the individual system. Methadone is authorized in the United States as a treatment for heroin addiction. There's 1,292 methadone treatment programs in the United States, trying to serve 228,000 heroin addicts. Dilaudid or hydromorphone is refined from morphine. Gram for gram is about 7 to 10 times more potent than morphine. Because of its potency, it is fairly well controlled. But we would like to say the same thing about fentanyl, but we can't. Fentanyl comes in from China. but it's not the only really heavy drug out there. Dysuvia is 1,000 times stronger than morphine, and it's new. And I don't know why why the Chinese have actually come up with this stuff. Oxycodone is a semi-synthetic derivative of codeine, and is used for moderate to severe pain. This drug is supposed to be taken orally, Percodan. You might have heard of Percodan. The effects begin after about 30 minutes. The effects last for 4 to 6 hours. It is a stronger drug than codeine, but weaker than both morphine or Dilaudid. The drug can be abused by chewing or crushing and injecting or sniffing the resulting drug. The manufacturer of the drug has tried controlling abuse by reducing the strength of the tablets, and all they're doing is massing the tablets and still using them and getting the same high. Meperidine is another name for meperidine is Demerol. It has been around longer than most of the synthetics or the semi-synthetics. I had kidney stones back in, what year was that? 1978. And they gave me Demerol to ease the pain. They knocked me out so that my kidney stones could pass. It's about 1/6 the strength of morphine, but is widely used as an injectable anesthetic. In large doses, Demerol can cause sedation and euphoria if you take enough of it, which makes it ideal for surgery because it doesn't suppress coughing or have the side effect of constipation. So they shoot you up with Demerol, knock you out, and then they do the surgery, and everybody's happy. Morphine makes you forget. That's one of the reasons why they give you morphine with something else. In my case, of course, they gave me morphine with Demerol. Theoretically, it was supposed to make me forget. Didn't work. I still remember what was going on. I woke up during surgery. This drug is the most widely abused by medical professionals, Demerol, because it is so widely available to medical professionals. Tolwin is a weak opioid antagonist as well as an agonist. When used in combination with other antihistamines, the drug is reputed to give a heroin-like high. Manufacturers have mixed the drug with naloxone, as weird as that sounds, the opioid antagonist, to reduce its use as an opioid accelerant. This drug is rarely used now to get a high because it's mixed with naloxone and you get the opposite effect. Propoxyphene is also called Darvon, Darvocet, Propocet, or Wyjesic. You may have taken a Tylenol with Darvon or whatever. It's a Tylenol 1 or something. It's used for mild to moderate pain relief. This drug metabolizes slowly and so can lead to overdose or addiction if not monitored. The drug is sometimes used as a replacement opioid for heroin treatment in place of methadone. Doesn't work very well. Of course, the person really doesn't want to get off of heroin anyway. Only 4% of overdose deaths using opioids have been seen with propoxyphene or Darvon. Not very many. Here's the great killer of young adults. 2/3 of all opioid deaths are due to fentanyl. How this stuff ever got out on the market, why this stuff ever got out on the market, we're not exactly sure. The Chinese are the ones that manufacture fentanyl, and that's how it's getting into the United States. It's coming in through China. It's coming up down from Canada. It's from China, it's going into Canada and coming down. It's coming up from Mexico. Fentanyl. It's 50 to 100 times stronger than morphine. It's used pre and post surgery to alleviate excessive pain. When your textbook was first written, fentanyl was not a problem. No idiot would take fentanyl. And then we discovered that people were dying from it. When Prince overdosed with fentanyl, and everybody went, where the hell did he get that stuff? you can't, it's not on the street. And the answer was, yeah, it is on the street. It was on the street, and that's how we discovered it in Minneapolis. Why in Minneapolis? Came down from Canada, that's why. Normally our drugs come in from Mexico. They come up from the south, not down from the north. But fentanyl came in from Mexico, or from Canada. It also now comes in a patch for chronic severe pain and in a lollipop, as wonderful as that sounds. There's also an oral transmucosal tablet called Actic, meant to be dissolved in your mouth. Street chemists have been able to replicate the structure of fentanyl with a powerful drug called China White. And the reason it's called China White is because it's white and it comes out of China. So that's a cool name, and I know. See, all of these drugs need to have really cool names so that, you know, you feel like it's like Pokemon, right? Okay, everybody. And it needs a symbol like Pokemon or any of those other. My grandson has all these Pokemon cards, and I haven't figured that one out yet. That just doesn't make any sense. But I don't think China White is one of his Pokemon cards, not yet anyway. Unfortunately, some of the street drugs contain MPTP, which kills the dopamine-producing cells in the brain, resulting in Parkinson's disease. At best, and at worst, a frozen addict who can't move for the rest of their lives. It paralyzes them. As much fun as the MPTP sounds, China White sounds like something, you know, like a painting or something. LAAM is a long-acting opioid that is used for heroin replacement therapy. It lasts for 2 to 3 days, whereas methadone only lasts for only 1 to 2 days. Because it only has to be taken every third day, take-home doses are unnecessary, as is the case with methadone, and that's what was happening with methadone treatment. LAAM metabolizes in the system too slowly for the drug to be used for pain management. LAAM is more tightly controlled than methadone, and despite its success in treating heroin addicts, the paperwork involved makes it an unattractive alternative than the more widely used methadone. As I said, there's only one LAAM treatment facility in the United States. Very common over in Europe, where they have a lot more heroin addicts than we do in the United States. But they don't seem to be hitting them with fentanyl. Heroin, they still have a lot of heroin, but not nearly as much fentanyl as we have in the United States. Now that I'm almost done, they're moving over. Naloxone and naltrexone are opioid antagonists blocking all the exogenous and endogenous opioids. These drugs can be given to people who have overdosed on opioids, blocking the deadly effects of the opioid structure. Unfortunately, naloxone is short-acting and has to be frequently administered to block the deadly effect of the opioid chemical. Naltrexone blocks the effects of the opioid for up to 72 hours to help prevent relapse. And of course, naltrexone is what we have out on the streets. Our first responders are all carrying around this stuff. In case they come across somebody with pinpoint pupils who is unconscious, they'll shoot them up with naltrexone. There for a while it was costing $120 a dose. I think it's down to $12 a dose now, or something like that, $20 a dose. Anyway, how many do you need in your pockets? Once upon a time you'd have to carry $1,000. Anyway, why don't we stop right here? We'll pick this up next time. Sorry that I didn't have any good news for you.